Speaker, health and wellbeing is a significant concern in our community, as it is in many regional areas. It is a concern that stems from a place of caring deeply about healthcare and wanting the very best for patients, families and staff. Every one of us wants better health outcomes for our community. This is something we all share. In recent years, much of the public discussion about healthcare in our region has centred on Albury Wodonga Health. I appreciate there exists a range of views about the redevelopment, governance, the future direction of the health service and the cross-border model itself. Building better healthcare is often difficult work. It is step-by-step work. It requires governments, communities and health services to work together. It requires persistence. In 2019, along with my colleague Bill Tilley and the then Chief Executive Officer of Albury Wodonga Health, Michael Kalimnios, we brought together the Albury Wodonga Health Roundtable because we believed there needed to be a forum where concerns could be aired and ideas could be shared. From that time, there has been ongoing advocacy for practical improvements that strengthen healthcare delivery across our region. That advocacy has delivered funding for a new mental health unit, supporting investment in eating disorder services and bringing the Butterfly Foundation to the border, securing investment in additional renal dialysis services and securing more than $500 million for the new clinical services building at Albury. There is much more to do. The Albury Wodonga Health model is far from perfect. The unique cross-border nature of the service creates challenges that other health services do not face. The intergovernmental agreement renewed in 2022 was an important achievement, but there remains work to do to ensure both governments maintain a genuine shared commitment to planning, funding and delivering services for our region. We must continue advocating for future stages of investment. We must continue improving access to services. We must continue addressing workforce challenges. We must continue progressing priorities such as digital health, electronic medical records, expanded services and the infrastructure needed to support future growth. Healthcare, however, is about more than hospitals alone. The future of health on the border will depend on getting the fundamentals right. Strong primary healthcare, earlier intervention, a skilled workforce and modern hospital infrastructure. My vision is for a health system that is integrated across our region. A system where a patient can move seamlessly between their GP, community health services, hospital care and specialist services. A system supported by modern digital records that improve safety and continuity of care. A system where people can access more treatment locally, reducing the need to travel from Melbourne or Sydney for care that should be available closer to home. I want to see Albury Wodonga Health continue to grow as the major regional referral hospital for our part of Australia. I believe there is enormous opportunity to develop the border as a centre for health education, workforce training, medical research and innovation. We have universities, TAFE, clinicians, allied health professionals and community organisations already doing outstanding work. The opportunity is to bring those strengths together through initiatives such as a health knowledge and skills precinct and through stronger partnerships across education, research and healthcare. And I believe that we can be a centre of excellence in fields such as paediatrics, leveraging off the wonderful clinical team we have. Importantly, healthcare in the Albury electorate extends beyond Albury Wodonga Health. It includes ensuring the long-term sustainability of services in our smaller communities and continuing to strengthen healthcare across the electorate. That includes supporting the future of the Urana multi-purpose service and implementing the newly developed service plan for Corowa Health Service so that local communities can continue to access high-quality care closer to home. As Shadow Minister for Medical Research, I see every day the extraordinary advances occurring in medicine and healthcare. New technologies, new treatments and new models of care are changing what is possible. Regional communities should not be spectators to that change. We should be participants in it. My ambition is that when people look at Albury Wodonga Health 10 years from now, they see not simply a community with a larger hospital, but a community recognised for excellence in healthcare, education, research and innovation. I believe that is a vision worth working towards, because at the end of the day, whatever our views on particular projects or policies, the shared ground remains the same: better health outcomes for our community.